Hello, everyone. My name is Karthik Rao, and I'm the product and brand manager for Practice Pro. I hope you and your families and team members are safe and healthy while we battle this health crisis. And today I'd like to take you through a quick tour of our new built-in telehealth solution. And really, it is quite as simple as schedule, invite, and treat. We wanted to design a solution that was easy to use, built already into your existing Practice Pro solution, and have a really easy workflow so that you can continue your business during this social distancing guidelines and so forth. So let's go ahead and jump right into the application here. There's a few things that we need to set up on the back end before you're able to utilize the telehealth solution here. And one of the first things here is making sure that your facility is set up with the correct time zone. So there's going to be a new setting here under administration and then clinic and your clinic setup. And that time zone, it should be set automatically for you, but just make sure that you're going in here and ensuring that this is the correct time zone selected over here. The second backend setting that you may want to take a look at, of course we have some defaults for this, are your messaging templates. So under administration and clinic, we want to go over to facility settings. And under facility settings, we are actually going to be driving the invitation system for the telehealth appointments right here through our existing appointment reminder service. Now, don't worry if you're not subscribed to our appointment reminder service. There is still a manual way to send these invitations, which we'll take a look at momentarily. But if you want to take a look at the existing templates and make some changes or that sort of thing, you want to go over to these facility settings, and you'll see here under the appointment reminder tab that there's actually going to be separate settings for your regular appointment reminders for email and SMS, and then a separate set of templates here for telehealth email and telehealth SMS. So you can kind of customize the messaging that goes out here. And the one important thing that you want to note here is that all the same tokens are available over here, and there's a new token here called telehealth meeting URL. So you want to make sure that you leave that inside of the template there to make sure that the invitation includes a link for your patients to click on so that they can access that telehealth meeting. Okay. So again, this is located under administration, facility settings, and the appointment reminder tab. And once again, just remember that if you're not subscribed to our appointment reminder system, you will still be able to send these invitations out manually. Okay. So the next step here, just kind of taking a look at the invite portion and now the scheduling portion here. So navigating over to the scheduler and over to today's date of service, scheduling a telehealth appointment is really as simple as scheduling a regular appointment. It's the exact same process, except we have one additional option that you can select at the appointment creation window. So we can see here that Homer Simpson is scheduled for an appointment today, and you'll notice that he has a little globe icon over here, and that is indicating that it's a telehealth appointment. So as I mentioned before, it's really simple. When you're going to schedule an appointment, if you double click on that appointment, it will bring up the edit appointment details here, and you'll notice that there is a new setting here at the top that says telehealth meeting. So quite simply, you just go ahead and check off that box right there and click on the Save button, and that will save this meeting as a telehealth appointment. The only thing to note here is that you may receive a warning if you try to schedule an appointment in the past. It will warn you that you can't schedule a telehealth meeting for the past. So there are a couple of things just to keep in mind when you schedule a telehealth meeting. Of course, it needs to be for the future. And also is that the room actually has a timer on it. So if you try to join the meeting more than 10 minutes before or 10 minutes after the starting and end times, then the meeting room will say that the meeting has expired or hasn't started yet. So just kind of keep that in mind when you're scheduling appointments and marking that telehealth meeting. But once the actual meeting has been set as a telehealth, as I mentioned before, you'll see this globe icon over here on the actual appointment. And now when you double click on the appointment and go inside, you'll see this join meeting link. So of course, clicking on that will launch the telehealth window right from here. So we'll come back to this in just a moment. But you can actually join the meeting right from here, or alternatively, you can join the meeting from inside of your documentation. So for example here, if we open up Homer Simpson's flowsheet, we go down to documentation and then open the flowsheet here. You'll notice that as long as an appointment is marked as a telehealth appointment, there's actually going to be in the documentation menu right across the top here. As a therapist, you'll see a meeting button here on the right. It'll say join meeting. So clicking on this will actually take you directly into the meeting as a host. Okay, so if I go ahead and click on this, you'll see it's going to pop open a new page here. So basically is that, if you have a setup where maybe you have 2 monitors or something, you can basically kind of document on one tab and you can flip back and forth between the 2 tabs. Or if you have a laptop and a tablet and you want to use the tablet for the video side and you want to keep your laptop open for the documentation side, that's fine as well. It'll certainly work that way also. So taking a look at the actual telehealth interface itself, it's really simple. We wanted to keep this simple so that you're able to kind of get your documentation done, get your session done without too much hassle. So when you log in here, basically it'll present you with the meeting ID, which is unique for that particular appointment and that patient, right? And then your name is going to be populated here. If you need to change that before entering the room, you can certainly do so. And right from here, you can also preview the camera. So clicking on the preview of the camera, there I am. Hello, everybody. You can just make sure that if your browser pops up a warning that says, hey, do you want to allow the camera and microphone, go ahead and click allow for that. But you'll see here there's a couple of buttons that you can operate here. That's muting your microphone and also showing and enabling your camera there. And those same controls will be available once you actually join into the meeting. So very simple. I'm just going to go ahead and click on the join button over here. And now as a provider, I have logged into the meeting and I'm waiting for the patient to join. You'll notice that you'll always see a preview of your own camera. And when the other participant joins, a bigger video will show up right over here. Okay, so let's go ahead and send the patient an invitation to the meeting. So back onto the schedule. If I right click on this appointment and go to patient and then down to invite to telehealth meeting, you'll notice there's an option here that says send SMS invitation and send email invitation. So remember, we set those templates up under the facility settings. So this is basically the manual way to send the invitation. And if you're utilizing our appointment reminder services, is that if the appointment is marked as a telehealth appointment, then it will automatically use the telehealth template instead of the regular template. So you basically have 2 different options here. It will automatically send at the same time as they normally would receive their appointment reminders, they will receive that telehealth reminder. And you can also manually send it right from here. So I'm going to go ahead and click on send email invitation, and that's going to send out an invitation to the patient. And we'll just kind of take a look here at the email invitation. Okay. So the invitation is going to look something like this. And again, you can customize what that invitation looks like. If you want to add in some information, or maybe you want to send them to a link on your website where there's some sort of form or some sort of consent that you need them to sign, you can certainly include that inside of your email preferences. But basically, once we go ahead as a patient and click on this link, either from their laptop, their tablet, or their mobile device, basically it's going to come up again. Same thing, the room's going to look very similar. Patient is going to be presented with a joint telehealth visit here, and they can also preview their camera. Here I am again as both the provider and the patient. Again, you have your microphone button, your camera button, and the patient would simply click on the join button over here, and that would place them into the conference. So now that we're in the actual telehealth visit, just a couple of features here on the screen available to us as both the patient and also the provider. So here you can see that there's a timer going that will track your time. We're actually storing this information in the database, so that will be available. As a patient, if you need some help either logging into the session or if you need some help just in general, your clinic's phone number will be populated here on the actual meeting interface. And some actual basic video controls. Again, we still have the muting of the microphone and also of the hiding and showing of the camera. And of course, also the ability to expand full screen. They can kind of rotate their camera here and also minimize as well. So again, all your basic video conferencing functionality here. Now, as I mentioned before, is that you will be documenting at the same time, and most importantly, generating charges here as well. So basically, whether you're utilizing the same laptop, you can switch back and forth between the tabs, or if you're using a separate tablet for the video or a laptop for this. One of the most important pieces here, of course, in addition to modifying your templates, maybe some verbiage on the actual documentation, is going to be your charges. And every payer seemingly has different rules and billing guidance for those charges. So we've actually implemented a new feature at the insurance level where you can control how you want certain codes to be presented onto the claim form. So here under administration, if we go to insurance and then go to insurance settings, you'll notice that there is a new section here under your insurance settings called telehealth billing settings. So the thing to keep in mind here about these settings is that they'll only apply if you're billing on a date of service or an appointment that is marked as telehealth. So in that scenario, when the actual appointment is marked telehealth, sometimes, for example, your payer may request you to use a different place of service code. So in general, by default, when you're, for a regular in-clinic visit, you may be billing as an office, and that code is different than telehealth, which is generally O2. So your payer may ask you to use the place of service code O2. You don't need to go change this in the default settings under facility settings. You can say that for this specific payer, if it's a telehealth appointment, I want to use place of service code 2. They may also request you to use a specific modifier. Some of the modifiers we've been hearing are things like GT modifier, 95 modifier, CR modifier. So you can actually set that specific setting for each individual payer right from these settings right here, right? So again, this is under administration, under insurance, and under insurance settings. So when you actually go to your documentation for the day and you generate those charges, whether you're doing that from your flow sheet, whether you're doing it from your SOAP notes, really anywhere where you're generating a charge, you will see that those payer-specific settings will automatically show up on your charges. So really the telehealth solution here is really quite simple, as I mentioned, right? You're inviting the patient, you're actually doing the session, and you're documenting here, and we're giving you some rules at the payer level to make sure that those charges are generating with the appropriate modifiers and codes. So thanks for watching this video today. If you're interested in signing up, you can get more information also at ptpracticepro.com/telehealth, or get in touch with any of our customer service representatives. So again, thanks for watching. Stay safe, stay healthy, and we're looking forward to speaking to you soon.